Here this morning. My name is Lina Vargas, and I have the honor of moderating the VLU EMPOWERALL webinars. And today, I'm very excited about today's topic because it is not necessarily one of our typical academic topics. It's a topic that is dear to my heart. I come from an underserved country, and humanitarian missions are definitely close to my heart. So we wanted to create this space so that we could share what has been done so far in terms of humanitarian missions by Venous and Lymphatic University, and give a space to the surgeons who have devoted not only their time and their skills, but a little piece of themselves in all of these humanitarian missions. So I'm going to let them share about the experiences. I have not been yet a part of one, but what I've heard is definitely worth sharing with everyone. So with that, we're going to hear from Dr. Rebecca Reachi and the mission that was led in Guadalajara. We're going to get started with Dr. Victor Canata and the mission in Paraguay. We're definitely going to hear from Dr. Lowell Kabnick, who has been at the core and heart of all of these missions. And then at the end, we're going to hopefully hear about future missions, specifically the upcoming one in Turkey. So with that, Victor, I would love for you to tell us more and share your screen.
Okay. I just want to say thanks to all the team of Vein and Lymphatic University regarding about all the work that we have done in trying to build a great and sustainable source of teaching and understanding regarding about vein treatments. So far, I've been working in Vein University for more than 5 years, and we find out that there was a lot of lack of teaching, a lack of so many things, and this is the final idea of this presentation. Vein care without borders, building solution for underserved countries. I don't have conflict of interest, and you have to know that a global challenge and a humanitarian opportunity is something that the small countries deserve. Vein and Lymphatic University were providing accessible and affordable and sustainable diagnosis and treatment in venous and lymphatic disease in regions with limited healthcare resources. We know that chronic venous disease affects millions worldwide, and the final idea of Vein University was transforming phlebology and education. We thought that the 4 pillars of that great idea will be education, accessibility, affordability, and sustainability. And we propose a global model: teach one, treat many, and build local capacity. The objective is not simply to perform calls during mission, but we have to leave behind a team who will be able to change the healthcare system. We are finding all over the world, and most in the underserved countries, that there were limited hands-on exposure. Training was not good. The theory was heavy, but the people was adopting so many things that were not good for them. We thought that Vein University, from our point of view, is leading the transformation of vein care and education. And in today's global era, the university empowers fellows, physicians, and healthcare professionals with cutting-edge programs that combine hands-on training, online learning, and humanitarian outreach. We feel that shaping the future of global phlebology together is the final idea of Vein University, and our work are in science we trust and in education we lead. The final idea was, when we start working, we have to get some source of voice to present our work. And this come out with VLU Voices, led by Anil Hingorani. This is a 4 times in a year online magazine who show us all the new stuff that coming in phlebology, as well as new congress, new abstract, new treatments. And one of them was directed to the VLU Humanitarian Mission in Guadalajara. Was really a great success. We also foster new treatments, new ways and new ideas of work. One of them is the total endovenous ablation that was already embraced by the team of Bain University. We showed to the people how they can do it, and we foster the people who try to doing it. Also, we work in teaching worldwide. We are having training session in Paraguay, also in Ecuador, as well in Guadalajara, and in so many countries in the world. One of the worst and the best idea was the humanitarian program leading by Dr. Kurşat Bozkurt, remain at the head of the university. And the mission is bringing essential vein care to underserved population. This was the idea of our training session that we have in Paraguay. We have training session worldwide. We lead so many meetings around the world. And this is the final idea of Bain University. One of the final people talked regarding about who was the meeting and what are the serving regarding about his future care. And the lady was really very happy. And at the end, we have this kind of people who just given a great music after we finish our humanitarian session in Guadalajara. Also, one of our great ideas was the ground round. Bain University ground rounds show us every Wednesday at noon, New Year time.
Innovation. Why should you tune in?
Bring us
Because at Bain University Grand
30 minutes
science
of
meets experience. It's where
cutting-edge education in vein disease,
and where you can learn
bringing so many worldwide physicians trying to teach us and show what is going on.
Every session is a blend of
leading by Dr.Lowell Kabnick as a moderator and bringing
groundbreaking treatments and
new trends, new treatments, new solutions for the whole world. It's just
your practice, sharpen your skills,
for free.
keep
You
ahead in
can
the fast evolving field.
join us just clicking and bringing yourself to the meeting. Also, we are transforming phlebology in education. We are having training pathway. Our team gain expertise in advanced sclerotherapy, endovenous technique, and complex venous disease management. Online webinars are done in so many worldwide meetings. They call us just to have a session in so many meetings around the world. We were in just a few weeks ago in Kazakhstan Venous Forum. Every session is designed to inform, inspire, and teach practitioners to deliver the highest standard of care. And the final idea is just to keep moving forward. We have so many ideas leading by Dr. Kabnick, as you see over there, and is teaching fellows and trying to hand by hand show what is new, what we can do, and what are the way to have a better approach for our patients. Dr. Bozkurt is leading the humanitarian session, and we are all over the world trying to get the education, teach our fellows, and get better outcome for our patients. And this is the final idea of Bain University. The final slide is just devoted to the people who help us and who join us. Under the leadership of Dr. a restless guy that is Dr. Kabnick and all the team that surround us. And we have so many people who help us, like Lina Vargas, like Rebecca Reachi, Anil Hingorani, Dr. Bozkurt, and so many others who bring us education all over the world. This is the final idea. Thank you very much for the opportunity. I'm ready to enjoy the end of the meeting.
Mhm. Thank you, Victor. That was great, and I appreciate that you really expanded way beyond the mission, and that part I think is very important, because it's not just about, you know, showing up in a place and spending there a few days doing treatments and teaching, but just leaving something that is long lasting and that will continue to impact care and the quality of life of the people in the country where the humanitarian mission happens. And I love being part of Venous and Lymphatic University for that same reason. All of the education that's happening at different levels or different stages is just really, really important. But let me ask you something before we move on to Rebecca's presentation on the humanitarian mission in Guadalajara. How does that even happen? Like, how do those partnerships happen? How do you enlist all the people? Because it looks like it's, you know, obviously we're naming people who are essential and are spearheading these initiatives, but it requires hundreds of people locally to make this happen. How does that even work out? How do you make this possible?
I'm sorry.
Yeah.
The final idea just always come through Lowell. Lowell is a restless guy in this. He is the one who move us. He is the one who foster us and who help us regarding about all the initiatives that we have in Bain University. He built a strong net with all of us trying to get new ideas, new teaching points, new people who really can help having a better outcome just for the patients. He usually is a restless regarding about trying to bring new works, new ideas, and teaching everybody else. And I follow just him in that structure. The final idea was to get back to the people who really need, teach the resident, and get better outcome for a patient. And this is something that we did since 5 years, almost 5 years with Bain University. Dr. Kabnick worked with all the people around the world, trying to bring them to our ground rounds that we have once in a week. And this is really difficult because you have so many people who usually is busy and is having they are working. There are so many different hours between one and maybe the States and Europe or maybe Africa, and he bring them to the screen. He bring to the Zoom meeting. He let them to deliver the new treatment, the new kind of machines or maybe new devices, and then we have like a 15 minutes of discussion, and that's everything is posted in our YouTube channel, meaning that we have more than 100 meetings that they are really top videos that will teach you regarding about all the disease in vein and in also in all the new structure that we have in Vein and Lymphatic University. And this is the final idea, Lina.
Our fearless leader, Dr. Kabnick, would you like to add anything before we move on to Rebecca?
I couldn't have said it better, and my mother's proud of me. Thank you. But it
awesome.
takes an army of people and volunteers to be able to do this. And in Rebecca Reachi's favor, I'm going to turn it over to her, but she was absolutely instrumental in the mission, humanitarian mission in Mexico. And so I have not said it enough, but publicly, thank you, Rebecca, for being able to pull this off. And I mean, I did 16 procedures, and I was in heaven, especially teaching attendings as well as residents. And I do have a scenario after that. So Rebecca, please.
All right, perfect. That is a beautiful intro. So what we're going to do is, because Rebecca is actually joining us, even though she's on vacation in beautiful Italy, she's taking time out of her day. I'm going to run the presentation, and so I'm going to share my screen. You guys, please let me know if you're seeing it. Hopefully you do. And Rebecca, you go ahead and tell me when you
Yes,
need
we
me
see
to
it.
move forward. Okay,
Thank you
beautiful.
so much. Yes, thank you so much for the introduction. Thank you, Lowell Kabnick, because you invited me to join this important mission. And like you said, I guess it was a humanitarian mission that it was 1 year ago in Hospital Civil de Guadalajara, that it's a public hospital. And before everything, I want to thank the people from the hospital who helped me so much, because without them, we couldn't do this. It's Dr. Martin Gomez and Dr. Iran Bojorquez. Both of them, they are the chief of vascular surgery there, and they help us to get the patients through the months. They performance the ultrasounds. They decide which patients we were going to treat them. So I don't know if you can pass this slide, please, Lina. Thank you so much. Here is Dr. Martin Gomez, and he is one of the leaders there in the Hospital CV. He helped us so much to give us the space, to give us the patients. And, you know, it was multidisciplinary. It's not only doctors, it's not only fellows. It was only, you know, surgeons, it was fellow residents, it was students of medicine too, who will go with us to perform all these procedures. And besides that, the first day that we arrived, we went to see all the, you know, the hospital. They show us the, you know, the rooms where we were going to perform all these procedures. So, could you give us the next slide, please?
Mm-hmm.
This is the team. It's a fabulous team. It was Ellen Hilgarani, Ruth Bush, of course, Lowell Kabnick, Kurşat, and of course, Victor and me. But I guess we have another one that is missing, that it was Kathleen as well. She couldn't do it, so we miss her. But this team, I guess, it was very, very, you know, unique. And besides, we are from different parts of the world, and we have the English spoken language only together. You know, Anil perfectly understands Spanish, Victor too, and Lowell too. So it was very helpful to that. So first of all, I guess it was a mission that we started like more than 6 months before we went to Guadalajara. First, to know that we were going to go, and then the second, all the manage of the hotel, they pay their own airplane bills. And besides that, that's the humanitarian mission. And besides that, we got some of the, well, from Mexico, we got some of the ultrasounds that they borrowed us, the laser, the fibers of the laser, some of the Caribbean, and of course, some of the Medtronic devices that they gave to us for free. And they didn't charge anything. We got the Varicio, capsules, the Barixon machine, to do all these things for free. So we have to thank all the people who are not only working, is the people who is besides us. I mean, all the people who are helping us, the nurses, you know, the anesthesiologists, the students who help us. Could you pass
Yep.
the next slide, please? Okay, before the first thing we did, could you pass the last, before this one? Yeah, no, the next one. The first thing we did is to, like you can see, this is a big forum where you can see it's full of students. First of all, the students of medicine, the fellows for 3 different hospitals there in Guadalajara, that there are the hospitals who has fellows of vascular surgery. For different hospitals that are public hospitals, it was the Hospital Civil Nuevo, the Hospital Civil Viejo, and besides that, there's the ISTE and the IMSS. There are 4 different hospitals. But first of all, we teach them about, you know, what we were going to do, what we were going to see on the patients, the venous insufficiency disease, which were going to be happening inside the surgery rooms, like you can see there. The next one, please.
Mm-hmm.
Yeah, thank you so much. Okay, so at the end of the day, we have more than 250 professionals participating, more than 15 lectures in 2 days. We performance 40 operations performance, but some of them were 2 legs. So we have 67 legs treated. And besides that, we have 3 different, between 2 and 3 different operators theaters. And then we have more than 200 hours of echo Doppler imaging. And some of the people, that it's very important, most of they travel not only in Guadalajara, it's out of Guadalajara City. Some of them more than 400 kilometers far away to get this treatment doing. So we have a lot of, you know, numbers here, but the most important is that most of the patients were treated more one leg or 2 legs together. The next one, please. Okay, about the numbers. Okay, we have didactic sessions that it was the first day with some lectures in English, most of them. We have some pieces discussing and about we have changes of thinking how we were going to do, and we almost we started the first day it was only lectures. The second week we started at 8 a.m. until 7:30 p.m. that we finished that day, the first and the second day on the surgery rooms. And we have our students were from all different levels of fellows. You know, in Mexico, we have vascular surgery that they started, some of them with general surgery, and then they choose to do vascular surgery. So we have fellows of the first, second, and third year. So some of them, they got the first day and the other part because they couldn't do, you know, they couldn't make both days because they have to work on their hospital, but they help us so much. The next one, please.
Mm-hmm.
So about the procedures that we performance, it was laser ablation. We have different lasers. Like I told you, all the equipment that we have, it was borrowed from people there. We have radio frequencies ablation, that is the closure fast. The glue ablation, that it's the vena block, that it's borrowed by Dr. Kurşat, and the foam sclerotherapy that we have it with Barixio, that they gave us all the capsules and the machine of the Barixio. And if we don't have it, we treat the Tesari technique, that is very easy. And we have the mechanical ablation, that is the MOCA with the clarivane, with some of the techniques that we did. Some of them, we teach 1 or 2 techniques in each patient. And besides that, we didn't have any complications reported. All the patients were discharged within the 3 hours post-treatment. Most of them were local treatments. Some of them, they were under anesthesia, but very few. Most of the treatments were under local anesthesia. And can you give me the next one, please? I want to thank the BLU for having me in this important humanitarian mission, and we are just starting, I guess. This is a good start in Mexico for all the people who are under, poverty, and they cannot afford this kind of treatments by paying them. So we choose this hospital because it's free. They didn't pay anything. So I want to thank Lowell, of course, to invite me to do this first humanitarian mission, and we are waiting for the next one in Vietnam. Hope we can do it. Thank you so much, Lina.
No, thank you, Rebecca, for sorry, Kurşat. Victor, can you check the text messages for Dr. Bozkurt? Thank you so much for sharing all of these beautiful numbers, but above that, what this means to patients in Guadalajara and for making this happen. So let's talk a little bit about the technology. So you were talking about some of the treatments that are, that are done. It sounds like you are able to pretty much offer the full spectrum of superficial treatments that we offer. So all of those were provided over there. It's not like you guys brought those, or how does that work? What happens when you are doing, let's say, a humanitarian mission in a country that doesn't have access to all of these technologies?
Okay, first of all, we have to ask the people who has these machines. I have 2 or 3 persons who are involved in this. And I asked them to borrow me the machines. It was a humanitarian mission. And the only thing we asked them is to borrow, for example, the Medtronic gave us the machine only 1 day. But Juan Med gave me the laser and the ultrasound 2 days. And some of the people, like Lowell, got some fibers, laser fibers that we have it there for all the patients. So and we asked the people from Baricio, who is not really Baricio in herself by Spain, but the people who are managing in Latin America. So we asked them and they gave us. And for example, we have only 1 sclerosants there in Mexico. So I bought them, but I mean, it's cheap. So a bunch of sclerosants, we have it. And for example, Kurşat has the glue. So he brings it to us. And for example, Ruth gave us from the clarivane, and I remember from the Medtronic that one of the fibers or 2 fibers, I don't remember, from Medtronic. So each of us gave something that it's not a cost for us. They get some of the people who gave us. I am really thankful to them.
And how about so all of you did the procedures, or did some of the surgeons there at the hospital, did they do any of the procedures as well? How does that work when you're, well, obviously I'm assuming you have that relationship with them, but if you are trying to do this somewhere where there's not that connection, how does that communication happen?
Yes. First of all, they have a very good, they were very organized. at the hospital with Irambor Jorges. He got all the patients between and they told us this is the patient they performance the ultrasound, so they choose the patients. So the patients arrive, and then we perform a quick ultrasound, and before we took it to the room, to the operating room. So we performed a quick, and I said, okay, I'm going to take this one, and I'm going to do this performance, this technique with this. And we all did that. It was very fast. With between one of them were in the operating room, the next one were checking the next patient to go into the operating room. So it was very fast. And I mean, we make like groups of two surgeons with some of the students, the fellows, who are inside the room, and we were talking to them, and we were explaining to them. And some of them, they are encouraged to use the gloves and try to do the performance, the technique that we were telling them to do. But it was very funny because sometimes the first person is like, oh my God, I'm just going to look at this. And the second and the third day, they said, okay, I can do it. So it's everything is under our vision. We were telling them how to take it, how to do it. And the first ones, it was like, okay, I'm going to watch first and then doing the second. So it was the first day, it was very quick, and the second day, it was faster. You know, when you got the technique, it is easier for each one to make the groups and to do, okay, I'm going to do this, and you're going to do this. So we were better the second day than the first one, like always.
Yeah.
But it was an exchange of mind of each one of us, because I operate on one side, and I'm seeing this and this, and I learn from the others too. You know, it's not only for the fellows, it's always to each one, learn from the others, the tips and tricks. That it's the most important thing.
Yeah, I think that's very important, and that's actually the beautiful thing about this is I can only begin to imagine, like, you guys gave so much, but I'm sure you learned and you gained so much, not only from a little a tip or trick, or maybe a technology that you don't necessarily use every day, but also just mentally and emotionally what you get from being able to deliver the care to these patients. So this is definitely, so it has to be so fulfilling. And I loved what Victor shared about see one, not see one, do one, teach one, but that, variation, which I actually loved, of like see one, treat many, and then leaving that long lasting, like impression, if I were to put it that way, so that this can be continued in the long term, which is ultimately the goal. It's not just impacting a small group of people at a specific period of time, but something that can be long lasting. And that actually makes me think of, like, how can we, and I'm not asking how you guys have done it, because I know this is a harder thing, but how can we like quantify, not in numbers, but like the impact that these missions are leaving? Like, what are these people that you guys trained? Are they being able to do this? Are they hopefully now teaching this? I would love to see that long term as more missions are, carried out.
Yes. And besides that, I guess it's very important to do a group, to the group that you are, you know them, but maybe you don't know them in the operation room. So each of these, we make some groups, and I said, okay, for example, I'm going to operate with root bush. And we together, if I cannot puncture the vein, the other one can try. And you can see how they manage the ultrasound, if I look at like longer or transversal. And everybody can see different techniques. That's the important thing of this. You can see all different techniques. How can I do it? And like I told you, the tips and tricks are very important for us, because the students and the fellows can see that it's not so difficult, because sometimes you are thinking that it's going to be, oh my God, it's going to be very difficult and everything. And when you performance it, you said, okay, it's not so difficult. It's easier than you think. So that's the important thing for me, is make it easier for the fellows. It's make it easier. They can see and they can try to do it. So that's besides the people gets the treatment for free, and it was very, if you listen the people who are very thankful because they got the treatment for free, they cannot afford, it's not affordable for them. So that's
Yeah.
the main thing for the humanitarian mission. But for us is to treat them, and besides to learn about the others. So everything is win-win. Never
Yeah.
lose. Yes.
So do you have any of the, let's say, the people that you train, the fellows, the residents, are you guys staying in touch? Do they, after the mission was completed, were they reaching back to you guys and saying,
I called
Yeah.
them to ask how were the patients, and all the patients went fine. No complications at all. I called them at that moment because normally you can change, you can follow them. And I know the treatment sometimes is not complete. It's step by step. We made the principal vein, the most of them, there were the saphenous vein complete. And some of them, they're going to go under sclerotherapy, that is for the smallest veins, but not all. So I know some of them, they have to go again to another therapy, but most of them, they are fine.
Nice. Thank you. Thank you so much for sharing that. Well,
Oh, no,
now
no,
I'm
it's my
very,
pleasure.
yeah, I'm very excited to introduce Dr. Bozkurt. Hi, Kurşat, how are you doing? Good morning, and thank you so much for being with us here today. I'm very excited to hear about what's coming in the future, because this hasn't ended. This is only the beginning. So I'm dying to hear about the plans for the next humanitarian mission.
Well, first of all, thanks again for this organization. Sorry, I am slightly late. I had some internet issues, some connection issues. Sorry about it. In the beginning, at the beginning, we were thinking to do the 2026 mission in Vietnam. Actually, we had a lot of conversations, we had a lot of meetings together with them, but we had one important difficulty in Vietnam from government side. Government didn't allow officially to do a workshop, and they didn't accept us to do some procedures over there. It's not finished. What they are saying now is they want to do that workshop in 2027 again in Vietnam, because they needed some time, and possibly we will do something in Vietnam in 2027. This year, VLU is going to organize a not humanitarian mission type thing, but it is going to be a training workshop for Turkish and also surrounding countries will join a workshop in Istanbul. It's going to be two parts. One part is going to be in my clinic, and we do some sclerotype things there. And in my university hospital in Cerrahpaşa Medical Faculty, we will do cases all together. The plan is except in very beginning of the November, and Victor is coming, Lowell Kabnick is coming, Anil is coming, and we will be organizing 3 days workshop for 25 young doctors from Turkey and from surrounding countries in Istanbul. Then in 2027, also India wants to do something, to organize something together with us in Mumbai. Shoaib Bashari is really very keen to do some kind of humanitarian mission there. So this is the future plans for us. And finally, I want to say something about Guadalajara mission. believe me, it was the most important days in my life. I'm a professor in cardiovascular surgery. I did everything in my life. Believe me, everything in my life. But that mission was superb. Rebecca was fantastic. The team was fantastic. We were good. We were. It was fantastic, man. You know, sometimes you can do one thing once in your life. Maybe Guadalajara will be something like that. I mean, it was the first mission, but possibly in the history of ELU will be the best one. I feel like that.
That's amazing. But so you guys have set the bar high, but you know, we can always raise that, right?
Correct.
I loved what you just said. Are you able to share with us like a single moment of your time in Guadalajara that is, has stayed with you the most, like a memory, something that has become a core memory for you?
I can jump in there if you'd like. And this is
I know. I want to hear from all of you. I mean, if you can all share, actually, and Anil, if you're here, like all of you, if you can share a core moment, something that has stayed with you, all this time.
It's not only Guadalajara, but I must talk about Victor and Victor's opening. And we've done many humanitarian missions in Asuncion, Paraguay, as well as educating their residents. And it's the same idea and the same amazing feeling that Kurşat had that I have. As an educator, it's very interesting that everybody, as you know, learns differently. And fortunately, I think I had the last patient of the humanitarian mission in Mexico. So all of the vascular residents and a few of the attendings were in the procedural room, operating room that I was in. And so I demonstrated on one leg what we were going to do on the other leg. And the vascular fellow was a scrub. And if the scrub knew what they were doing, then I felt very comfortable that it would be their time. And this particular doctor had not performed any procedures. This was going to be her first. And she actually kept up with me step for step. And I said, "It's your turn now." And all of the residents looked at her and I said, "Are you ready to access?" And she said, 100%. And so she started holding the ultrasound probe, which is what I do, and accessing with the needle. But I saw that there might have been a little glitch. So I took the ultrasound probe. And as soon as I did that, all of the residents brought out their cameras. And she got in right away without a question. And all the residents applauded her. She did the case from start to finish. And I just watching her beam, the thought and the emotion that she was able to do this made me feel really good. So that was my take-home moment from the student point of view. From the attending point of view, that was also there because all of us were able to show different techniques. And more importantly, as was said by Rebecca, we learn from one another. Well, I never thought about that. And that's what I've learned from students as well. So thank you very much for allowing this. Kurşat, thank you for organizing it. Yes, all the industry were there behind us in terms of in-kind grants. Rebecca brought her laser. It was amazing. It was all together. And that's what our family is, BLU. Thank you.
That's wonderful. Do you guys, Rebecca, Kurşat, Anil, do you guys want to share a moment that was special for you?
There was one thing very special for me when we were in Guadalajara. We were unbelievably tired. That's why all evenings we went up in the hotel and eaten only pizza because there was only pizza there and I had enough pizza in my life. Since then, I'm not eating any more pizza because I was expecting fantastic Mexican food, but even one evening we were unable to go there. Still laughing.
That's so funny. Rebecca, how about you?
Well, I guess it was the end of, because when we finished, they have a surprise for us. They didn't tell me anything, but at the end, they make there is a lot of music there in Guadalajara, mariachi and everything. So they gave us a special gift to us that they used to give to the doctors who are teachers, because they're in the hospital civil. They make all the students to vote for the best teachers that they have, and to that people they gave us it's a figure of a San Bern the priest some Antonio Alcalde, that is the name of the hospital. They make it in a it's like a piece of a flyer, a figure, and they gave us to each one because we were the best teachers from them. So they gave us that. It's very important for them to give us we went there to teach the people there, and they make some like Victor put it on the video. They play some songs for us to thank us.
Wow.
So I guess that's amazing.
Yeah, I'm sure you have an idea of like the impact that you had and how grateful people were, but I'm sure it's greater than that. I'm sure it's bigger than that. But yeah, seeing those gestures of gratitude are just absolutely amazing. It really gives me chills. So yeah, I saw the video, but I didn't know that it was something that they had done for you guys.
Yes.
To thank you.
Like it was like a surprise.
Oh,
They play some music there, there is a mariachi and everything, but they were young people who are students from musicians, and they play for us, and they gave us this statue of Fray Antonio Alcalde. So
wow.
it was great.
Oh, that's amazing. That's
Yes.
amazing. Anil, how about you?
Really, I just wanted to emphasize, not only is it great to be able to teach others, but also what I learned from the other people who were there, because I don't use all of the equipment that we had available. I learned a lot by seeing what other people were doing. That was really something I took home. And sure, I went there to teach, but I ended up being taught. So that was something quite useful. And I think these humanitarian projects, every one that I've been on, I always bring back something home, something I can use to help my patients in the US. So thank you so much.
Yeah, I actually just posted, I didn't even put two and two together, but I just posted this week earlier on social media. I was traveling in Peru. I went there for a conference, and then I stayed, I had the fortune of just travel around with my husband and my daughters. And I think, we are so lucky. And that's what it made me realize. Obviously I have lots of friends in Colombia, that's where I'm from, and I realized that, people are still getting the old fashioned, surgeries because they don't have access to these. And I was able to meet a really nice young man who told me that when he realized that I'm a vascular surgeon and I treat veins is my passion, he was telling me that his mom has advanced disease also, and she has never been able to get treatment. And it's everywhere. Like, it doesn't take much to, just realize that there's patients with vein disease and unable to get treatment, and just how lucky we are to have all of these, and for you guys to be able to be a part of that, and how much you learned and gained from that, I can only begin to imagine. So one final question to all of you guys, whoever wants to take on this one. What does it take for someone to, who's never done this, to like get involved? Like, mentally, emotionally, like, logistically, like how does someone get involved? How do we get more people involved? Is that something that's necessary? Like, how do we amplify this? And for people who are really thinking about joining, and how do they even do that?
I guess the first thing is that you wanted to be there, that you are like available. First of all, you have to give time to this. It's not only oh yes, I want to participate. No, you have to take into an account that it's time that you are going to lose, maybe working. But I guess our profession is like this. I guess our profession is humanitarian. So this is for me part of giving the world a little bit back of mine, all the things that I have. So if I can help, I'm available. So the only thing is that you have to take in account that it's some days that you have to travel, and you have to cover your expenses. You have to pay the things that you are going to do. I mean, for example, Kurşat gained some money for traveling and to give for a company who help us, for example, for the hotel. But most of all, we have to pay our own airplane tickets, or maybe, for example, I rent a car and I pay by myself. I mean, everything that you have to do is because you want it, not because somebody is paying for it. So the first thing is that you have to be available and you want it.
So it's, for people who may be watching this webinar in the future, if they want to get involved, can they get involved? Can they, be a part of this?
The answer to that is absolutely. Anybody that wants to sacrifice themselves for a number of days, we're all in. That's what we're looking for, because we're looking for faculty, we're looking for education teachers, and give back. That's what Venous Lymphatic University is about.
Well, perfect. I think we could keep talking about this for hours, but for the sake of time, I want to take this moment to just thank you, not only for being here today, donating more of your time, but for everything that you've done so far and everything that's coming in the future. Thank you, everyone who joined and everyone who's going to be watching this video afterwards. I want to take a quick moment to introduce next month's webinar. It's going to take place on July 25th, and I'm very excited about this one. We're going to be talking about specifically on phlebiaesthetics, the combination of laser and sclero, and the big debate of like the two schools of which one goes first. So it's going to be a really, really good one. We have a good lineup of speakers. So stay put for the announcements for these future webinars. And thank you so much. I hope you all have a wonderful weekend.
Thank you.
Thank you. Bye. Bye, everyone. Thank you.
Bye.
Bye.